Good morning, everyone. Good morning to the first year Bachelor of Pharmacy. Welcome to Rhodes University. Most importantly, welcome to the Faculty of Pharmacy. I'm Professor Sandile Khamanga, the head and the dean of the Faculty of Pharmacy. We also have a deputy dean, who is Dr. Carmen Altman. Before we start, I think it's important just to give you an outline of who we are as a Faculty of Pharmacy. We are going to start by introducing ourselves and also presenting to you what pharmacy is like in South Africa and Rhodes University, and also just a package on our curriculum and what lies ahead for you in the future, and a couple of advice and support that we have as a Faculty of Pharmacy. In South Africa, there are 9 universities that offer the Bachelor of Pharmacy degree. And these 9 universities are scattered all over the country. We have one, which is the Faculty of Pharmacy, Rhodes University, and it is the only Faculty of Pharmacy. The other universities, they have departments of pharmacy, they have divisions of pharmacy, they've got schools of pharmacy. In that way, we present ourselves in a unique position because of our visibility, not only at the university, but as a university that is having the Bachelor of Pharmacy. We started this many years ago. We're also going to introduce you to the South African Pharmacy Council. You're all going to understand what the council's role is about. It's a statutory body that regulates and has been established in terms of the Pharmacy Act of 1974. What it does, it regulates the practice of pharmacy and pharmacy support, and also the pharmacy profession as a whole. And we are also going to introduce you to the Pharmaceutical Society of South Africa, which is a society that supports and promotes the profession of pharmacy. On average, South Africa graduates about 1,000 pharmacy students in a year. And our member bodies, when you look at the WHO, over 65% of member states, they report to have less than 5 pharmacists per 10,000 population. And in other countries, there are about 5 pharmacists per 100,000 the population. What does that mean? We need to ensure that the profession of pharmacy, being us in the forefront of the provision of health, starting from where the medicine comes from, the distribution of the medicine, it gets to centers, into hospital, up till the patient receives the medicine. In South Africa, we need about 1,000 pharmacists per year to reduce the shortage. There is a challenge with that. Jobs are scarce. What does that mean? It means as pharmacists, starting from now, our curriculum as it is, it needs to speak to the present and to the future. I've said a little bit about the South African Pharmacy Council. As a statutory body, it's appointed and elected by the Minister of Health and for registered pharmacists. It looks at the competency standards and it inspects all sites that offer the Bachelor of Pharmacy degree. So the South African Pharmacy Council comes to universities every 4 years. It's part of accreditation and monitoring. I spoke briefly about the Pharmaceutical Society of South Africa, which is mainly interested in the profession. There are different sectors under the Pharmaceutical Society of South Africa. There is the Academy of Pharmaceutical Society of South Africa. There are also pharmacists working in community pharmacies, the Community Pharmaceutical Society of South Africa. and pharmacists working in hospital institutions, and also pharmacists working in industry. What speaks to you as pharmacy students is the South African Pharmaceutical Society, which is the federation. So it's called the SAPSIF, South African Pharmaceutical Students Federation. It's a voluntary body. You can take on your membership there. I think it's good for first year students as they come to university to familiarize themselves with the three bodies that I've spoken to: the South African Pharmacy Council, the Pharmaceutical Society of South Africa, and also the student body, which is the South African Pharmaceutical Federation for the students. The BPharm is a 4-year degree under the NQF level National Qualification Framework. Is at level 8. What you do after the 4 years, all candidates, all students will do an internship, which takes 1 year. And after the internship, everyone is going to do a community service, which is also 1 year, before registration with the South African Pharmacy Council. So it takes a minimum of 6 years for one to be registered as a pharmacist, registered to practice independently. Coming to where we are as a faculty, we have about 20 academic staff, including contract staff. More than 50%, it's about 60% of our academic staff, they've got PhDs. 25%, they have master's degrees. And we also have those who have qualifications in nursing, and we also those who have qualification in health sciences. Most of them are registered pharmacists. On average, we have about 680 undergraduate students starting from first year, second year, third year, and fourth year. And our postgraduate students, on average, we have 50 postgraduate students. These are students who are doing Masters of Science in Pharmacy, Master of Pharmacy, PhD, PharmD, which is a Doctor of Pharmacy. There are 4 main divisions, or as you take up your courses, you'll be in the 4 divisions. The first one is pharmacology. The second one is pharmaceutical chemistry. The third one is pharmaceutics. The fourth one is pharmacy practice. I've spoken about the South African Pharmacy Council. What you're going to realize as you enter into the program, you've got very few choices because the content, our curricula, is what has been prescribed by the South African Pharmacy Council. And you are also going to have what we call professional indemnity, and we'll take you through this as we start our year. I'm just going to take you through briefly to what courses you are going to do in first year. You are going to be doing chemistry in first semester and chemistry in the second semester. You are also going to be doing introduction to ICT, that's computer science, and you are also going to be doing cell biology, and you are also going to be doing mathematics for life sciences. That's what you're going to do in the first semester. In the second semester, you'll continue with chemistry that you started in first semester. You are now going to be formally introduced to the Faculty of Pharmacy. You'll start doing anatomy and physiology. You'll do pharmaceutical biochemistry. You'll do the foundations of pharmacy, an introduction to the laws, introduction to calculation that are specific for pharmacists. In second year, you'll start a new course called Pharmaceutical Chemistry 2. You'll continue with anatomy and physiology. We are going to add a component called pathophysiology and pathology. Then the third course is going to be, you continue with the pharmaceutical biochemistry. We are going to add a component on microbiology and immunology. You'll start doing pharmacy practice 2 and pharmaceutics 2. You are also going to be introduced to credits. Level 1, which is BPharm 1, and level 2, which is BPharm 2. For you to proceed, you need to accumulate 120 credits in first year. In second year, you need to accumulate 120 credits. In third year, the way we structured our program, we've slightly increased number of credits in BPharm 3. There are 135 credits. And I'm going to take you through the courses that you'll do in year 3. The first one is Pharmaceutical Chemistry 3, Pharmacology 3, Pharmacy Practice 3, Pharmaceutics 3. We are also going to have another course which is Biostatistics. In the final year, which is Bachelor of Pharmacy 4, we have 135 credits. In the first semester, you'll be doing Pharmacology 4, Pharmacy Practice 4, Pharmaceutics 4. That will be the end of the first semester. Then on the second semester, you do one semester course called Pharmacotherapy. What pharmacotherapy means, or what it entails, you are unable to start with pharmacotherapy if you have not passed all the other courses that you would have done from first year, second year, third year, and the fourth year courses, because it is the integrated course. It picks from pharmacology, it picks from pharmaceutical chemistry, it picks from pharmacy practice, it picks from pharmaceutics. Everyone completes that course before they graduate. All our students have an option to do 2 electives. We've got a number of electives, starting from Isikosa for pharmacists, exciting. Do counseling, choose business planning, choose veterinary pharmacy, choose sports pharmacy, choose public health, choose geriatric pharmacy, and many more to come. The last course that everyone completes in the final year, it's research methodology. This is introduction to research for all our students, so that by the end of the 4 years, you complete the program, you have an appreciation of what research is about. In the context of COVID-19, it's very important for one to understand what's good research, what's bad research. It is in that course that students will be introduced to systems of being able to critically evaluate research, analyze data using biostatistics, information, and also drawing from the other courses that one would have done. It is not everything that we do in class that we say we complete the degree. Our students in all the years, first, second, third, and fourth year, they complete what we call work-based learning. At the end of semester, all our students go to do some form of learning in retail pharmacy, in industry, hospital institutions, or in research organizations. That is very important to be able to integrate the theoretical knowledge into what happens in practice. Our students as well have an opportunity when they're in their final year to participate in what we have as a paper train. At the beginning of the year, there is a train that goes all over the country. It's a 9-month operation. Our students have an opportunity to see what really happens. The train goes to remote part of the country where most probably some of the patients there have never seen a pharmacist, have never seen a dentist, have never seen an optometrist, have never seen a dietitian, have never seen a medical doctor coming into their communities. Our students have taken part into the paper train. It is an activity that we are excited about, and we hope that some of you will find resonance in what we are talking about. In the Faculty of Pharmacy, as I've said, we do not only offer the Bachelor of Pharmacy qualification. We have the master's degrees, we've got PhD degrees that our students embarked on if they want to continue with the academic work. I'm a proud product of that system. I studied at Rhodes University. I spent 4 years, the undergraduate degree. I spent 2 years doing a master's degree. I spent 3 years doing a PhD degree. And that has brought us to where we are today. We also have very strong collaboration with research organizations. And in our faculty, we've got a biopharmaceutical research institution. What it does, we look at computer modeling and topical products. We look at bioequivalent studies. What it means is when there are products on the market, we are able to do studies to compare those products to determine if they are similar or not similar. We are also able as well to do clinical work in the Faculty of Pharmacy. There are many competent researchers in the Faculty of Pharmacy who work in the area of health literacy, patient information, health education, antimicrobial stewardship, natural products chemistry and quality of pharmaceutical products, water quality and health, synthetic and medicinal chemistry, in pharmacology, also in formulation development, veterinary pharmacy. We also look at formulation of dosage forms, liquid, solid, semi-solids. We are able to do testing for that. What message do we have for you as a BPharm 1 student? We've got exciting news for you. We know that you completed in 2020. You are a resilient group. You've got what we call grit. You are ready for this program. We are very excited that you have chosen us amongst all other pharmacy schools, departments. You have chosen to come to Rhodes University. We are going to work with you. We are going to structure your program. We've already prepared your lectures. We've prepared your practicals. You'll be happy to know that you'll have time to participate in sports. You'll exercise. We take your well-being, your health very, very serious. You'll have your social life, but you'll also require of you to take a journey to yourself, to have a SWOT analysis. What strengths are you bringing here? We are going to work on your weaknesses. There are a lot of opportunities at Rhodes Universities where leaders learn. And we are also aware that there are threats in every new endeavor. We say to you, listen, look, question. If you need clarification, if you are able to argue, if you are able to understand, your strength is to be able to write down things, to review things. And in all of that, we are comfortable that at the end, you'll be able to develop the required skills. Required skills in people management and interaction with others as you work in your small groups. But the total package depends on you. We say in the Faculty of Pharmacy, people get jobs. Degrees do not. You can acquire the degree. There are certain traits, qualities that will be required of you. It's vital that as you embark on this journey, you take a journey to yourself, know yourself of who you are. We say to you, the road that you are taking, there are thousands of other students who have gone through this. Don't panic. We are here for you. We are going to help you. We've got tutors, we've got demonstrators, we've got professors, we've got lecturers, we've got year coordinators, we've got heads of divisions. The office of the dean is there for you. There's a counseling center at Rhodes University. Anxiety, depression, it's real. But the exciting thing is, after 4 years, we usually meet in April when you graduate. You are a 21 group. Year 22, you'll be in second year. Year 23, you'll be in third year. Year 24, you'll be in fourth year. Year 25 in April, you'll be graduating. That's the message that we have for you, the Faculty of Pharmacy. We believe in you. That's why the relationship that we have started with you, it's not just going to end when you graduate. It's an everlasting. Once again, we thank you for choosing Rhodes University, for choosing the Faculty of Pharmacy in Makanda. Thank you.